Let me just shut the door.
Hi, Phil. Can you hear me all right? Splendid. So I'm Laura. We've just had a bit of a kind of pre-recording chat, and I'm really looking forward to finding out about the research that you're doing. So I wonder if you could just introduce yourself before we start the interview.
Sure. So my name is Phil Wilson. I'm Director Head of Nursing within the Surgery Division at Birmingham Children's Hospital in the West Midlands. And I am also a fourth year going on fifth year PhD student with the Open University. I started back in 2017. My research is exploring the roles that nurses have had over the years as bed managers, site managers, flow coordinators, responsible for managing large cohorts of patients, large departments, and what nurses bring to those roles in terms of the safety and quality of the patients and the activity and performance of the hospital directorates.
Wow, that sounds like a really unusual kind of focus for the research. I wonder if you could talk to us a little bit about how you kind of came up with that that kind of topic for exploration, but then how you kind of refined it to a specific question.
Yeah, sure. So a few years ago, I was the manager of the site management, bed management team here at this hospital. And I was very fascinated with the role that nurses played of being the senior officer in charge of the site 24 hours a day, and in particular out of hours. During the day, each ward has a ward sister present. Out of hours, the site manager acts as the overall nurse manager for the hospital and everything else that comes their way, but in particular managing the emergency admissions and the patient flow through the departments. So when I looked in the literature, what I found was any work that had been done on these roles largely focused on the performance of the hospital, such as the hospital meeting the ED 4-hour target, reducing the hospital's length of stay. There'd been very little work done on the contribution that nurses in these roles brought to the safety and care quality that the patients received. So the particular focus of my research is what is the contribution of nurses who work as bed managers and site managers to the care quality that's received by hospitalised patients.
Okay, so just to sort of ensure that I've got this clear in my mind, was it the case that the outcomes that were kind of being looked at within that role were generic, and you were interested in what specifically nurses in that role brought?
So I think it probably needs a bit of explanation. So these roles, the roles such as bed manager, site manager, have only existed since the early 1990s. Prior to that, you had sort of night sister, who was sort of responsible for the hospital. As pressure on A&E departments increased, you needed somebody who was going to have a bit more autonomy to make decisions about where patients were placed in the hospital and how the support of A&E would happen. So in the early 90s, largely these site manager, bed manager roles were created. And what work is in the literature after that very much evaluates these roles by the hospital's ED 4-hour performance or how the hospital manages its patient flow. But there's very little that looks at how the patients are kept safe. So for instance, how does the site manager or bed manager assess whether the wards can keep taking patients from ED? How do they assess whether ED is becoming crowded and there are risks in ED? How do they respond to complaints from families out of hours? How would they respond to infection control issues out of hours? As the roles have expanded in the hospital at night services over the years, a lot of these nurses have gone on to be advanced nurse practitioners and also get involved in the patient care side of things as well. So these roles have unfolded over time. So, but what little has been in the literature very much focuses on how these roles improve the hospital's activity performance, and very little of it has been about the contribution to care, safety and quality. So the focus of my work is the care, safety and quality.
Okay, so how on earth then did you set about designing a study that could address those questions? There's multiple kind of questions within that main question. So how did you design that?
So the other thing that needs to be thought about is that as a specialist, as a nursing role, it really is not really recognised by nursing's professional bodies. So, for instance, the Royal College of Nursing, the NMC, has written lots of publications about advanced nurse practitioners, research nurses, educators, ward sisters. But for 30 years, we've had senior nurses in charge of every hospital in the country 24/7, but our professional bodies have never really recognised them or written about them. So to me, the first big gap was just that. The way I went about doing the study for this was to design quantitative research to interview and do vignette conversations with bed and site managers in a particular trust, and also with general managers, nurse managers and frontline nurses to understand these roles and how these people working these roles contribute to care safety and quality.
Okay, so did you design a kind of schedule, or did you let things just go where they were going to go for the interviews?
So I designed a schedule of questions bespoke to nurse managers, general managers, frontline nurses and bedside managers themselves. And I designed 12 vignette scenarios to have with bed managers and site managers in order to then ask for their response to how they would respond to particular situations that were put to them.
Okay, so they were kind of provided with clinical situations, and then they just talked through what they would do, and you presumably recorded their responses to that. They were verbal responses.
Yes, so the scenarios were really quite varied. So some of them were related to activity in ED, some of them were related to a patient wanting to make a complaint on a ward in the middle of the night. Some of them were related to a member of staff has become ill in the night. Some of them were the power has failed to the hospital. Some of them were, you know, a range of different sort of situations which them as the senior nurse overnight would be expected to go and respond to. So so I put these scenarios to them and then asked them to narrate to me how they would they'd respond.
You must have done some kind of like interesting apocalyptic thinking to come up with those scenarios. Wonderful. So interviews and vignettes and then kind of recording them. Did you encounter any particular ethical challenges when you were kind of getting consent to undertake this research?
I mean, I think the first thing to say was, considering this was research not involving patients, it was research involving only staff. It's still a lot of effort to have to get through all of the NHS, IRAS and HRA requirements is the first thing I would say. That although it might sound as though it's not, you know, it's not doing anything like affecting treatment with patients, nor am I interviewing patients. It's a purely interviewing staff only research, but it was still a lot of hurdles and a lot of obstacles to get through, would be the first message. You know, the amount of amendments and back and forward to the HRA I had with it, when I was kind of thinking that it doesn't really feel like I'm doing all that much, but
yeah, so some people describe going through that process of getting ethical approval as kind of being sort of painful but helpful. I don't know if that was your experience in terms of.
I would say definitely painful but helpful, because it certainly contributed to improving the research process, because it made me have to uncover every stone and turn everything over. But yeah, and I'm sure in terms of looking onto the writing up of the PhD, it'll make a big difference. But yeah, I guess I was just surprised that when you fill out the IRAS forms online and you click that it's a staff only, so a lot of sections do get greyed out that now you don't need to, because it's not involving patients, but there's still an awful lot that is not greyed out. And thinking about how you will look after the staff's welfare, even in a 20-minute interview, you know, it caused me to think about, you know, there are probably one of the ethical things I had to think about was being a nurse researcher and also a relatively senior nurse manager in the NHS. If someone discloses something to me that made me think that things were of concern, then how I would respond to that. So I had to sort of explain exactly within the ethical applications and also on the participant information sheet sort of who I was, and you know what responses I may have to make in the event of me hearing something that was of concern. So that was the first bit. I think with regards to getting consent, Not especially. I think I was very lucky. I think the hospital that agreed to participate in this research is very proud of their hospital's site manager, bed manager team. They were very happy for someone to do some research into it. And I had very good engagement from the senior members of that team who helped promote it amongst their colleagues. So I was very lucky. I got very good participant uptake. Doing the interviews was a real pleasure, to be honest. I've got very fond memories last summer of doing them.
Yeah, data collection, really, really fascinating, can't it? And did any of those ethical issues that were kind of identified as risks by the various bodies, did any of those arise?
No, they didn't. No. I didn't hear anything that was outside of what I would class as the normal busyness of a busy hospital.
Yeah, sure. So when we were talking before before this interview started, you were kind of saying that you're now embarking on your data analysis. So these interviews and these vignette responses were recorded and presumably transcribed. So what's next? How are you going to go about? Presumably you've gathered quite a lot of data over 2 years. So what's next for your kind of analysis?
Yeah, so there's 12 vignette conversations and about 12 or 14 semi-structured interviews to process. So the semi-structured, so I'm using thematic analysis, using Brawl and Clark's approach to thematic analysis. The semi-structured interviews I've sort of completed so I'm doing them as two completely separate studies, if you like, doing it as a multi-method study, so complete with the aim of triangulating them. So the semi-structured interviews I've completely coded and themed, and that is complete, if you like. And I'm currently in the process of theming. I've coded and I'm currently theming the vignette conversations. And I'm probably about 80% of the way through.
Wonderful.
My aim is by the end of this academic year and at the end of August to have completed all the data analysis and then be moving on to writing up.
Yeah, wonderful. Okay, brilliant. So, I mean, I've kind of worked through the questions that I wanted to address. I wondered if you kind of wanted to add anything. And I suppose specifically, I'm thinking about your area of research is an unusual one for nurses to go into. So you're certainly the first person that I've interviewed who's specifically looking at nursing management. And I wondered if you've got kind of any inklings of what's going to kind of come out of it. Obviously you haven't done your analysis, but you were there for the interviews. So
I think probably the message I would want to leave people with is that the organisation of care is care.
The organisation of care is care.
Yeah, so I think that we shouldn't think of it as, so yes, the care delivery is, with the patient delivering direct care, but I think that the organisation of care is care.
Yeah.
If you don't have good organisation of care, you don't deliver good care. I think that the same level of evidence-based thinking should be applied to how care is organised as much as it is to how it is actually delivered at the hands-on phase.
Yeah, absolutely. That makes a lot of sense. I will be watching really closely for when your publications are forthcoming. I'm really looking forward to hearing how it goes. I agree. It's really fundamental, important research. I think our students will find this really fascinating. So I just want to really thank you for offering your time to talk about your research and wish you luck with your data analysis and the dreaded Viva. Thanks.
Great, thank you.
I'm going to stop the recording now if I can figure out how to. There's too many menus. Stop recording. Thanks, Phil.
Okay, that was great. Thank you. Was that